Today we have Robin back as a guest today. Robin is going to be talking specifically about her work in hospice and using essential oils and aromatherapy in that particular environment. So, Robin, welcome back today. Nice to see you
Thank
again.
you. Nice to see you again. Last time we did this, we did it with frankincense.
Yes, that's correct. Yeah, that was about a year ago now, wasn't it? I think.
Yeah, I think so.
So,
Yeah.
yeah, time flies.
Tell me about it. This
So,
time we're going to talk about hospice and aromatherapy.
yeah, no, it's quite an interesting time that we're talking about this. As I know from my personal experience, I'm visiting a hospice every day at the moment, as you know. So, yeah, it's kind of interesting to see how you work in that environment. So, yeah, if you could tell us, that'd be awesome, please.
Well, the first thing I actually have a course on how to use aromatherapy and become involved in hospice using aromatherapy. So if anybody wants, they can take the course. It's a 2-hour course, and I also give you transitioning oils and a patch, which I'll go into a little bit
Okay.
in this also. And after this, I can give you the link to the course because
Okay.
it's all online. So,
Okay.
and if you're not in the United States, you can take the course too. I just can't send you the oil and the because the oil is hazardous overseas. So I can't send it to you, and I can't send you the patches. And also, it'll cost a fortune in shipping to send it, but you can still take the course. I
Okay.
actually have the course at a lower price for those where I can't send the transitioning oil to.
Okay.
So I have two prices for it.
Okay. I'll pop those details just below on the screen here so everyone can see.
All right. And as I said, I'll send you the link after this and you can put
Okay.
it in.
Okay. Brilliant.
So how did I get involved with hospice? I've always been interested in working with those that are sick and those that basically cannot take care of themselves anymore. When my kids were younger, I did a lot of volunteering in local nursing homes, and also I worked in a hospital, a local hospital, taking care of premature infants. So I always liked that type of work. And as the years went by and my kids became older and I had to go to work, that wasn't an option anymore. But when I went into aromatherapy, on this part of the United States, it's very hard just to hang a shingle and say you're a aromatherapist. You basically have to have some kind of side profession. Otherwise, it doesn't feed you, it doesn't pay the bills. And I wanted the ability to be able to use it because we run into many obstacles because in this area of the Northeast, aromatherapy means nothing. Certification means nothing. It's not a licensed profession. So being certified, unless you're in the business, really means nothing
Mm,
because they don't understand what it is, what aromatherapy is to begin with, never mind using it on those that are very sick.
mm,
So, but I always like going into that aspect of aromatherapy in my regular practice. I also, shutting off my phone, I also found that I like, because I'm a senior, I liked working with seniors. So, because you know the ins and outs of somebody who is 60 years old and older, you have the same aches and pains and feelings that they have. So it makes it easier to figure out how to help them.
Okay.
Of course, I do younger, but I found that that age group was just easier to deal with, and or they listen more. But so I decided that I was going to join a nursing home and get back into the field because it was almost 30 years and technology has changed, rules have changed, everything has changed.
Mm.
So I started working in a local nursing home, but without aromatherapy, just volunteering, just to get my feet back into working with those that are disabled and those that are sick. And I decided there was an opening at one of the hospice centers, and that's local. And I decided, you know what, I'm going to sign up. They're looking for volunteers. And basically, that's what you have to do first. You have to volunteer because you have to find out if you can handle being around those that are so sick and those that might die the next day. And a lot of people can't deal with that. And a lot of aromatherapists will tell me, how can I get into aromatherapy using my skills in hospice? And I said, you have to volunteer
Mm.
because you can't throw it at them immediately anyway, because they might not even be interested in doing aromatherapy. And it doesn't matter at that point. What matters is if you can handle working with people that are so sick,
Mm.
and you'd be surprised what you see, because you're going to see people that are going to die tomorrow. You actually see them about to die. You're going to see people that are completely disabled. They can't speak, they can't talk, they just stare at you, or they're comatose.
Mhm.
You're going to see people that shake a lot and scream a lot. You have to be able to handle that. If you can't handle that, even as an aromatherapist, it doesn't matter. That's the most important. You must go and see if you can handle being around those that are so sick.
Mhm.
Once you volunteer, and usually most hospice organizations, when you volunteer, is you can't just walk and say, here I am, I'm coming in and I want to go to one of your patients. No, no, no. It doesn't work like that. They're responsible for you. So you have to sign a stack of papers this high, because there's HIPAA things that you have to deal with. And so you can't tell others, you can't use a first name, you can't use a last, God forbid, you can't use a last name. You can use he or she, and or you can make up a name. I'm in the process of writing a book, so I'm doing it on the memoirs of what I experience in hospice using aromatherapy. And the names that I'm using are animals or birds. So
Okay.
this way I'm leaving out their real name.
Interesting.
So, yeah, because you can't make an association because of HIPAA restrictions. So you'll probably have to take a course with them, because number one, you have to learn how to deal with these people. You need to know what to do in a case of an emergency, who you call, what you could do. You need to know what body parts you can touch and what body parts you cannot touch. So and you have to learn all their rules of what you can do and what you cannot do. And every hospice agency is different. There are hospice agencies that are for nonprofit, and there are hospice agencies where they make money. I like to go to the ones that are nonprofit, mainly because I think they care more. They're not out for it just for the dollars. They're
Mhm.
really out for it because they get most of their money from Medicare and from grants, Medicare, Medicaid, and grants. So, and they're subsidized by the government also. And of course, they do have a board where they do make some money, even though they're nonprofit, but not because they have to pay staff.
Mhm.
So, but not everything goes to their corporation. So that's why I like going to nonprofit. I found I've worked with profit and I'm not happy at all. So I go more to nonprofit organizations.
Okay.
And so now you've filled out all their forms, you've done everything. I don't approach them with aromatherapy first. I go in, I volunteer, I go 2 or 3 times a week, whenever I can go. And they allow you as a volunteer to sit and talk to the patient. You might come in as they actually have music certifications, people that come in and play specific music for those that are very ill. It works beautifully. And you might be walking into a session like that. There are some that play a harp, and it's really,
Mhm.
really nice. So you want to see what's around you first before you throw in the aromatherapy part. So, and I suggest that you, for at least 6 to 8 months, volunteer, even a year, just volunteer. Go down, get your feet wet. You need time to see if you can handle it. It's very emotional. So, you could say, well, I had a parent, a friend, a relative, somebody who was in hospice. Yeah, but that's different than actually going down and sitting with these people because they're very sick.
Mhm.
I've had a bedpan thrown at me. So they can be very aggravated till they don't like where they are.
Mhm.
So you have to give yourself a full year before you even approach them. You must be certified. No organization, because they have you as liability, will not look at you unless you're certified
Mhm.
at all, because they don't want the responsibility because you're under them.
Mhm.
You should have liability insurance of your own just in case, because you are making products. You're not exactly selling them in a part of your consulting, but you're still making products, and God forbid somebody gets hurt or whatever, you have to have insurance. You must have liability insurance.
Mhm.
That's important.
Mhm.
So now you're there a year, right? Now you want to approach them. Basically, you would go to the head of the volunteers, the director of the volunteers, and you would explain what you could do. You have a whole year of looking at all these people. You take notes when you go home and you figure it all out, and you write down all your notes so that when you go to approach an organization that you're working with, or another organization that's actually looking for an aromatherapist, you know what to say because you have the experience of a whole year worth of being with this type of person.
Mhm.
So you know basically what to say. So you sit down, you explain aromatherapy, you explain what you can do. I can help them with anxiety. I can help them with stress. I can even help them with pain. I can make all different types of products, and then you would come up with the different types of what you would make and how you would do it. And then you can give them links to different sites that show what aromatherapy does. And aromatherapist knows where to go, where to pick up the links to show them what essential oils can do. And you're not only using essential oils, it depends on the situation. If it's a situation where their hands are very dry, you can make a lotion or a cream, because we learned that in aromatherapy also, and make them feel better. So you're not just using essential oils. Once they decide, okay, you're the one that they're going to use, now you have to fill out a whole bunch of more papers, because now you're a consultant. So you're not working, you're not an employee. Some of them will hire you as an employee. A lot of them want you as a separate contractor, as a separate consultant. I do it as a consultant because I can go from one hospice to another. I'm not tied. Once you become their employee, you can't go to another you can't go to another organization and become their employee too. Doesn't work like that. So you're better off doing it as a consultant, because now you're on your own, and you could go to 20 hospice centers because they're hiring you as a consultant. You're giving them an invoice for what you're doing.
Mhm.
And normally you don't charge them what you would charge as a regular consulting fee, because they're poor. And most of the time they rely on grants for alternative medicine. Almost all their alternative medicine for hospice nonprofit rely on grants. Medicare doesn't pay it.
Mhm.
Medicaid does not pay it. Comes from grants. The music comes from grants. The massage therapist that they use comes from grants. So they also, some of them have Reiki. That's all grants. If they don't get enough money in the grants, guess what? They're not hiring you.
Mhm.
And if you tell them you want $400 an hour, out the door you go. So, you got to be reasonable. I charge by the patient, not by the hour. They could not afford me by the hour, my regular fee. So I charge a price per patient, plus the blends that I make. And normally the blends are not expensive. They run somewhere between $15 and $25. So they're not expensive. So, and that's how you work with them. How does it all come together?
Like, do you in the hospice sense that is do you work with them and say, right, that patient would be good, don't go to that one, go to this one, if there's a pool,
What
they give you guidance on who you should go to.
they actually pick the person.
Yeah.
So
Yeah.
what happens is I will get an email, and I have a private email address just for it's technically controlled and it's secure, just for the nonprofit organizations. And they will send me an email and say, kitty number one is needs this in aromatherapy. They need something for anxiety. So I say, okay, I have access to the medical portal. That gives me everything: the family members, the name of the patient, and the medical history. It is very, very important. And I stress it terribly that you must find out if the essential oil will change the prescription drug that they're on, because you could make them worse,
Mm.
not better. If you use an oil that has, like for instance, rosemary. Rosemary you can't use among those that have seizures. So if you look up and down their chart and you see that they're taking medication for seizures, you can't give them something with rosemary, because you might bring on a seizure.
Mm.
So you have to be very, very careful of, what you use. You get full description of all the medication. You need to know if they're on oxygen. A lot of the essential oils have flash points. You don't want to blow up the nursing home, nor the patient. A lot of these patients are not just in a nursing home. They're in hospital facilities, and they're also in their own home. So, and you can't be a fly sitting on the wall when they're using the products that you supply that have essential oils in it.
Mm,
So you don't know if they're going to put it right next to the oxygen tank. So you have to know in advance
mm,
if, and it's usually on their portal, if they're on oxygen. It's one of their medications. The doctor has to approve everything I do. So anything I come up with goes to the doctor for approval.
mhm.
Since he has absolutely no clue, one particular nursing hospice center I work with, he has no clue about aromatherapy. He said, "You're the expert. I trust you." The best thing I did is I actually made something for him. He was going overseas on an airplane. His back was killing him, and he didn't want to have to take a drug. So I made him a salve, and he said, "Oh my God, I could actually move and get off the plane." Well, that sold him. So at this point, he says, "Robin, do what you want. As long as you don't kill the patient, do what you want."
What, what sort of I imagine each client is different, each patient is different. So, do you formulate the blend accordingly, each particular, and
Yes,
is it,
what I do is you need to know the whole person. You can't just decide, well, the nurse wants for anxiety. Well, that's wonderful. What do? You're looking at a computer and seeing Jane Doe in the computer. How are you supposed to know what to make? Well, I go back to the family members, and a lot of these patients can't talk, or they have dementia and they can't go back. So I go to the family members, mother, father, sister, brother, whoever is close to them. What smells do they like? Because if they don't like lavender, no matter what I make, it's not going to work.
mm,
What smells don't they like? Well, that helps too, because either way, sometimes they don't know. So if they don't know a smell, because lots of them don't live now with their family members, a lot of them are in their late 80s and they have children of their own and they're not around them anymore. And they don't remember what they did. So I say to them, "Tell me what your mom did when she was younger. Give me a history of what she's done.
mhm,
What was her employment? What were her hobbies? Did she like to garden? Did
mm,
she like to smell flowers? Do you happen to know what she planted?"
mhm,
These are things I need to know, because this makes it me be able to figure out what to make them.
mhm.
And then the family member usually opens up and gives me everything. And then they'll also throw in that the nurse didn't bother to throw in. By the way, they have my mother has a terrible pain in her hip. Do you have something you could give her for that too? Yeah, I can. So I will make two things to bring, and then I send them an invoice, and then they pay me.
Okay, okay,
The hospice center pays me.
yeah.
I also make things for the family member that visits, because they feed on the hospice patient. So if they're off the wall, then the patient is off the wall. And a lot of these people won't let go and die, because they're so afraid of what their loved ones are going to be able to handle once they die. They hang on.
Mm,
So I give them an inhaler, best friend. I
Okay.
give them an inhaler and I teach them how to use it.
Mhm.
And I make them usually for anxiety. So this way, if they're nice and calm, then they relate to their parent or mother or father that they're nice and calm. So it like evens out. So if they're both using something, because this you smell, you're the only person that's smelling this. So it doesn't lead on to the one that's, that is laying there in the bed.
Mm,
So, and the smells don't interact
sure.
because I don't want to give something topically and it might be something different than when I'm giving the patient. So I don't want the patient to be totally confused.
Sure. Yeah. And you obviously
So,
you may find the patients too, because of their condition, as they progress through their stages. It
right.
help
And when I do it for family members, I go through the same thing.
yeah.
What medicines are you on?
Mm,
What smells do you like? What smells don't you like? Because it's important because I'm doing the same thing to them as I'm doing to the patient, that's very ill.
mm, yes.
So,
Yeah, you'll find yeah, I imagine that smells will change as well. Like one month that person may like that, and then all of a sudden, no, I don't like, just because of the medications they're on and the stage of their
right, I've had that too, where I've gotten a phone call and then all of a sudden, a month later, they tell me, what you made is not working,
mm,
or she doesn't like the smell anymore.
that's yeah.
Okay, so what So, did you make any changes in medication? Yes. When were you going to tell me this? So,
Mm,
so I'll yell it nicely, yell at the
yeah.
nurse. That would have been nice if you would have sent me an email telling me that you made a change in the medication because that's important because they don't realize what if she decided to have seizures and here I made something with rosemary and you didn't bother to tell me.
Mm,
So I keep on top of them now. Every week,
yeah.
I email them, has there been any medical change? Has there been any medicine change? What is going on? Has oxygen been added?
Mm,
Because if oxygen's been added, stop the essential oil. I will make a hydrosol instead.
yeah. Do you also work with the massage therapist to use a balm, like so they can massage if that is in their treatment, so to speak?
If it's there,
Yeah.
because when I make something, orders have to be put in. Just like in a hospital, my orders have to come in. I make a sheet of exactly what essential oils or frankincense that I've used or butters that I used because I have to give all the ingredients just in case there's an allergic reaction somewhere. And I give directions on how many times a day can you use this. In hospice, the hospice organizations only usually the nurse only visits usually once or about 3 or 4 times a week. So there are gaps. The caregiver that comes in between the nurse.
Mm,
So they're covered every day, but not 24 hours a day.
mhm. Okay.
So if something, and the nurses in the homes itself, if they're in a nursing home, they won't do it for you. They don't want to be bothered. It has to be done strictly by hospice or a family member. So if a family member comes every day, some family members will sit all day, because it's their loved one and they don't want to leave. So they'll come at 9 o'clock in the morning and they'll leave 9 o'clock at night. Usually I have them put whatever I'm making on 2 to 3 times a day. So they could do it in the morning, they could do it in the afternoon, they could do it before they leave, depending on what I'm making. If I'm making something I want them awake, then I tell them do not put it on them in the evening. And this is in the orders. One copy of the orders goes into the patient's book. One copy of the orders go on, I have lots of pin cushion things, those little pin pads that you onto the wall. They hate me because I ruin all their walls. And I put it on the wall so that when whoever comes in can pick it up and put it. Usually it's kept in the nurse's station because other patients have a habit of wandering. And I don't want them using their stuff because I don't know what they're allergic to or what their problem is. So the nurses keep it in the nurse's station, and all they have to do is go over there and pick it up.
Okay.
And they know it's there.
Okay, it's all there. So is there any particular oils that are the most common ones that you use?
Yeah. And how I apply is as a couple of different ways. I don't use topically because it's very hard to control. In other words, I don't use it in a bottle. I don't use one of these because I don't know how many drops they're going to pull out of the bottle and smear all over the person. I don't want that happening. Since I have no control over this, even when with those that are home, you still can turn it over, drip, 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 drip. You can wind up with 35 drips and put it wherever, and the whole house will stink from it.
Yeah,
So,
yeah, yeah.
and the other problem is if somebody else is in the room, that creates a problem too. So I don't like this. When you put it on, everybody smells it. So I don't work with and also the problem with this, it's glass.
Of course,
So if it
breakage.
shatters, if it falls and shatters, then if the patient is getting off because they have no shoes on, they could get cut, even on the little slithers that might be.
Yeah.
So I don't use this at all. What I use is a spray.
Okay. Nice. Yeah.
Okay. Spray is easier. Spray hydrosol can go in here. You can use plastic as long as it's dark. The patient name goes on here. It says aromatherapy spray. Do not use on anyone else. I mean, I plastered this thing. And then I have shake before use and keep out of the sun because I don't want them putting it on the shelf of the sun, the window, because then the sun's going to come in and kill it. So this is great. I use this for essential oils also. And how I do it, I don't want water in it because, as you know, water spoils. And I usually only make a 2-ounce bottle, nothing higher. Number one, I don't know if it's going to work for them. And since hospice is paying for it, I don't want to give them, this is a 4-ounce. I don't want to give them a 4-ounce bottle and then find it doesn't work. They still have to pay me for the 4-ounce bottle. So I put the oil in with a little bit of liquid Castile soap, the liquid Castile soap, to mix the oil for the fatty acid. And then I fill it with vodka. Now, there's a
Nice.
trick about vodka.
Nice.
Very interesting.
Oh, that's awesome.
Vodka works 2 ways. If you're making something for anxiety, it's uplifting. If you're making something for sleep, it's calming.
Mm.
And it actually works. And vodka at least stays longer
Yeah,
than water. Even though vodka does have water in it, it's not putting it in complete water.
that's true.
And
Yeah,
it keeps its alcohol, so it keeps it a little bit more sterile.
yeah,
So I tell them with the hydrosol, they should put it in the refrigerator and then take it out.
yeah,
But with the essential oil, as long as they keep it in a cool place away from anything that's dangerous, then it's fine. And what we do, this is hydrosol, this is frankincense. All right, so what I usually do is, because a lot of them are either in a wheelchair or they're in bed, they have a pillow behind them. So I will spray around the pillow. This way they can smell it. A lot of them are always cold, so they have the blanket all the ways up to here. So I'll spray the top of the blanket. One little spritz. That's it. One spritz. One spritz like that around. One run around this way. I'll also spray one on each shoulder. I'm going to feel good after this. This is sacra. So this way they get a whiff of it. And I tell them, don't go crazy. Put it around their pillow and see if you smell it. If you smell it, you don't have to put it anywhere else. So if there's no pillow, then of course you can put it on their shoulder and on their blanket if they're bringing it up. So this is the most way I use for those, because it's the easiest. It's less confusing because you can't use an inhaler because a lot of them are not conscious. So they can't do it themselves. Their hands shake. You don't know where they're putting it. So you want to stay away from inhalers. The other thing would be to use a salve for pain. And I, as you know, am the frankincense queen. So frankincense is wonderful to make infusions and then make salves out of it. And when you make a salve, the only thing you have to make sure that they're not allergic to trees, because frankincense is a tree, and they're not allergic to beeswax, or they're not allergic to bees. So if you're going to make a salve, you have to make sure. If you're going to make a cream or a lotion, the ingredients that are in it, you have to make sure they're not allergic to it. What I usually tell people is do a little patch test on them and make sure. And I make sure I use the most gentle. I am so allergic to everything. So usually if it works on me, it'll work on anybody. But I check anyway. And so you can use salves. And take out your trash cans. Oh my goodness. Alexa. You can use, this reminds you, you can use lotions and salves. I do a lot of that using frankincense because frankincense is excellent for different types of inflammation on the body. So you can use that. You can use carrier oils. I've used Tamino oil all by itself, no essential oil in it, because one patient under his arm, he had boils. And it was so painful that he could not raise up his arm at all. And the pus was like oozing out. That's how bad it was. And I said, you use Tamino oil for shingles. Why couldn't it work on this? They tried everything. They tried all kinds of creams. He was on antibiotics. Nothing was helping him. So this time I had no choice. I had to go to the doctor who was in charge. And I said, I'd like to use this. And can you have the nurse apply it? The worst that'll happen is nothing. We found out that he's not allergic to nuts because that's what Tamino oil is made up of. So we had a good shot of trying to help him. And they applied it under his arm. And within hours, you could see he could finally start to move his arm up a little bit. And they applied it 3 times a day for 3 days. And you could actually see the boil shrinking.
Wow.
So it's amazing what this stuff does. Wow. So they were sold. So, when you're an aromatherapist, you know the things, you're trained and you know the things to use. And there's one other thing that we do. And when they're about to die, the day they're going to die, the nurse usually knows. She knows by their breathing. She knows by their stats. And what they will do, and I make this up for them, that's what's in my course, is I make a transitioning oil. And in that oil is a bunch of oils that are for anxiety and for passing. I use rose geranium. That's very good. I don't use lavender because lavender can be stimulating,
Mhm.
not calming. So you don't want to take the chance of them pulling away from dying.
Mhm.
So I use rose geranium mainly because rose is way too expensive to use. And I found that rose geranium smells very similar to roses,
Mhm.
so it does help. I'll put petitgrain in there for calming, and I will use Boswellia neglecta, the essential oil, in there also. And there's a couple of other oils that I will put in there. And the nurse gets one of these with a dropper on it. It's a 3 ml bottle with a dropper, so she doesn't have to touch the essential oil. And this patch goes on their skin. It could go on their skin, or it could go on it could go up here.
Mhm.
And all it is a patch. And they actually use this patch for, I'm going to pull it up so you can see it. They actually use this patch for preemies. They were putting it on preemies with a little drop of lavender to calm them down. And it's sticky on the back, and it has this, it's hard to see, but it's got this circle over here.
Mhm.
And you put it right here on the patient, and you put 2 drops of oil the day he or she are going to die. And it allows them to let go. When they know the patient is ready to let go, they don't change their clothing. They just leave them alone, and they allow them to die. And I've been in the room with about 3 patients who were right at that point. They happened to live local, so I was able to run down to them and put the patch on myself.
Mhm.
And I watched them pass. And before they passed, they were like this. And when they passed, they're like this, very, very calm. So they let go and they went to the next realm. The advantage of why I don't use this regular is because first of all, they're not cheap, and they change their clothing daily. So they don't take it off and hold on to it, they throw it all out.
Mhm.
So it's too expensive. When I do it in a regular house, when I go to somebody's house, we'll put this on. There, I'll give them a dropper of oil, and they'll put 2 drops on. And usually it's the caregiver that will do it.
Mhm.
So, or the nurse. I don't like giving it to the family member to do it because I'm not sure if they're going to miss or whatever. It goes to the caregiver or to the nurse that comes to visit.
Mhm. Okay. Okay. Well, that's fascinating how that um,
And
works.
I make it generic
Yeah.
for male or female. So it works for men. Like the smell. I found that men like the smell of rose before they pass.
Wow.
They
That's
they
interesting.
find it very calming.
Isn't that funny? Because normally, that it's not a masculine um, scent at all. Really, it's always
No, it's not.
associated
But
with
they like
femininity, and even in my
it.
experience, a lot of men won't gravitate towards rose at all. Even me, I like it, but
No, but when they're going to die, they like that smell.
wow.
They like the smell of something, maybe because of the mixture that I'm putting it in with everything else, it cuts the smell.
Mm.
but a bit, but they liked the smell.
Wow.
So I was afraid. I didn't know if it would work for a man.
Mm.
So the first time we put it on, I was there and you could see he really liked the smell. I mean, he was totally gone, but you could tell by his body movements that he liked the smell. It's like when a man wears a pink shirt,
Mhm.
you know, a lot of men now wear pink shirts.
Yeah, yeah.
So
I don't like pink shirt either. Now I
it
quite like
is.
them. Yeah, yeah,
So,
yeah.
but you really, those that are watching this should consider taking my course. I go into it very deeply. And I'll give you one example of how aromatherapy works so well. There was one patient, when she was younger, she was in a concentration camp in Germany during World War II, and they used her for experiments. So she was about 12 years old,
Mm.
and she had a mother, father, and two sisters. The mother and father and the two sisters were gassed. She was left, and the only thing that kept her alive is because they experimented on her. When they were, when the Russians came in and destroyed everything and they were freed, she was sent to family members in the United States. And because she had no family here, they all perished in the gas chambers. And she was raised by an aunt, and she went on with her life, and she actually became a doctor. And because of being around all this gas, and I guess whatever they experimented on, she developed lung cancer, and it spread to the rest of her body, and she was put in hospice. They had to hold her hands down because she was constantly ripping at her face. And usually they're not allowed to restrain in in a hospice
Mm.
environment or even a nursing home, but she was basically almost ripping her face apart. So they had to restrain her. And when they restrained her, her hands were like this and shaking, and she was screaming because she put herself back to the horrible times. So I found out from her family that she lived as a child on an orange farm, where they grew oranges. And she used to sit under the trees, read books, and peel oranges and eat it. Well, this was perfect because orange essential oil smells like oranges. So I made orange essential oil, and I put some petitgrain neroli in it, which is a cold distillation. And it is wonderful because they take the flowers and the leaves and they cold distill it.
Yeah.
And it's half the price of neroli, but it works just like it.
Mm.
And I mixed it with the orange, and we took a spray bottle, and I did this what I make in this spray bottle, and I had them spray around her. And the day after, she opened up her hands and stopped screaming. The following day, they released the strains, and she was so calm because she put herself back to when she was a child. The smell put her back to
Mm.
when she was a little girl.
Mm.
She died 2 days later, but very peacefully. This is how aromatherapy works.
Mm. Yeah, that's a beautiful story, isn't it? To kind of, in the sense of how at the end,
If you think about it,
you know,
then you get the one who threw the bedpan at me. The nurses said to me, be very careful how you walk into his room because he hates everybody. He had a massive stroke and he could only use his hand, one hand. And he had one of those long sticks to be able to grab what he wanted. But please don't stand next to him because he will strike you. So God knows what I'm saying to myself. What am I getting myself into? I walk in and I try to explain what I do, and he wants no part of this. And I spotted in the corner, he had a box of Hershey Kisses and peppermint patties. And I said, "Oh, you like Hershey Kisses and peppermint patties?" And he goes, "Yeah, my brother sends it to me." So I said he could talk. So I said to him, "My favorite is peppermint patty." And he goes, "Really?" So now he's going to test me to see if I'm full of it. So he goes, "Well, can you hand me a Hershey Kiss and you can take a peppermint patty for yourself?" So I said, "Well, I can't do that unless I ask the nurse, because I can't give him anything without permission." So I went to the nurse. She said, "Feed him whatever he wants." She said, "Give him whatever he wants because he doesn't eat well, and if he wants this, give it to him." So I thought, "Oh my God, he's going to kill me handing it to him." But he took it. He watched the expression on my face as I bit into the patty. And I said, and he said, and I said, "Oh my God, this is fabulous. I haven't had one of these in years." And he saw that I wasn't lying to him. So he goes, "Okay, what do you do?" So I tried to explain to him, and I said, "I can make you feel like you're not here." He goes, "You could do that?" I said, "Yes." He said, I said, "Tell me what smells you like." "Well, I like dirt." "You like dirt?" "Yeah, I like dirt. I like the smell of dirt." He worked in a quarry and he liked the smell of dirt. "Can you make me dirt?" "Sure." I humored him. "Sure, I can make you dirt." So now on, so I left him. I said, "I'm going to go home and make it for you." And he said, "Will you come back tomorrow?" And I said, "Yes." So I go, "What the heck is dirt in an essential oil?" So I go outside and I grab some dirt and I smell it. And I go, "It smells like patchouli. That might work."
Okay.
So you have a smell for, you either like it or you don't like it.
Mm.
To me, it smells like leather or dirt.
Okay.
So I made him a spray only of patchouli. I didn't want to put anything else in that because I didn't want to mask it. And patchouli is very calming. So this might actually work.
Mm.
So I come marching down to him, and the nurses are peeking into the room to see if he's not going to kill me. And I said, "I brought you dirt." He goes, "Get out of here." So I said, "Can I spray it on you so you can see?" "No." So I said, "What if I spray it on my own hand and I let you smell it?" So he goes, "That works." So I brought it up to his nose and he goes, "Oh my God, you made me dirt." He said, "Put it on me, put it on me." So I sprayed him. Oh, was he wonderful? Then he opened up to me and told me his whole life history, everything. He made me stay there a whole hour, told me everything. And I said to him, "It's getting dark and I don't like to drive in the dark." So he said, "Will you spray me again?" I said, "The whole room stinks from it." I said, "I'm not spraying you again. The nurse will spray you again. She has orders of when to spray you." So, because no family members visit him, and I convinced the nurse on staff only because she could walk into the room without him killing her. When I walked out, 4 nurses lined up. "Bless you." I said, "Well, that's what aromatherapy
Wow.
does. You pick the right thing and you figure it out."
Yeah.
And
And since then, he was okay after that point. So
yes, he was okay. He was calm. He let the nurses come in as long as they sprayed him.
Okay. Okay.
You're right. He went through about 3 bottles of this.
Oh, bless you. That's
I
awesome.
wound up making him, I said, "This is it." I wound up making him an 8-ounce bottle.
Okay.
So, so I didn't have to keep coming down.
Yeah.
So
The
he
nurses
died
appreciate
about
it.
2 months later, but he died happy. So
And he'd let go of.
He let go. He let go of all the anger.
Yeah.
He was angry because he was there. He was angry because he came home from war and found his wife in bed with another man. So that didn't play very nice. And when he got a stroke, he couldn't do anything. And you know, as a man yourself, that men don't like to be helpless.
Mm.
And he was so helpless. But this gave him a feeling of righteousness, if you want to call it, made him calm. And it took him out, as he told me, he felt he was flying out of the room.
Mm. Wow. Well, that's a beautiful story of how you created dirt as an
Dirt,
aroma.
dirt.
Use that, yeah, not patchouli because he didn't want patchouli. He wanted dirt. So,
He
and,
wanted dirt.
and you were
He
able
didn't
to,
know why. This what smelled like dirt.
yeah,
Smell. I had my husband smell. I said, "What does this smell like?" He said, "Ew, it's disgusting," because not everybody likes patchouli, the smell of patchouli.
yeah.
And usually, if I use patchouli, I cut it with something else that's stronger, sweeter, so that it cuts the smell a little bit. But
Mm,
I made it straight for him because I knew if I cut it, it wasn't going to work.
mm. Wow, yeah, that's a fascinating story. How and actually how you were able to translate his request for dirt into patchouli as well. That's quite intuitive as well to actually pick up the dirt because it could have smelled like something else as well, you know, depending on where you were, chemotype, etc., etc. So,
And there's so many different things you can use. Like I use Boswellia neglecta infusion, frankincense Boswellia neglecta. It is excellent for calming, but what it does is it opens up the lungs and makes them less tight.
mm,
So the fluids pass through. So those that have lung cancer, we apply onto their chest and they don't go as much. It
mm,
really calms. It's a very calming oil and resin because when you put it right here and right here tented together and smell it, it's great for anxiety. It's great for sleep. I use a lot of it in my essential oil blends that I make for anxiety
mm,
for hospice. And I use it in hydrosol because I distill my own resins.
mm,
So when I make it, I use the hydrosol and or by itself, and or I'll mix it with other hydrosols as a blend and use it that way.
mm,
It's very good for COPD. It's very good for bronchitis, anything that has to do with the lung passage.
mm.
It's excellent. And I use that a lot. I have infusions going like this because
Wow,
I infuse for 60 days. So I have them all lined up so that I have enough.
wow. Do you also experiment using myrrh?
Yes, I'm careful with myrrh
Mm,
because myrrh I will use more for wounds
okay.
and in an infusion. Myrrh, you have to be very careful because it moves the blood. So you can't use it on anybody that are on blood thinners or heart medicine. So you got to be very careful how you use myrrh.
Yeah, yeah, yeah. I love myrrh as well as a resin as well as frankincense. But I like the contrast between the two is quite interesting, isn't it?
Hmm. And when you blend them together, it's really nice.
Do you ever blend do anything with the nursing staff? You know, do they ever come up to you and go, "Oh, could you give me something?" You know, like to
Yes, all the time.
yeah,
And they get it for free. They don't pay for it.
yeah,
So I'll make something for them as long as it's within reason.
yeah,
I waive my consulting fee for them.
yeah,
So they only pay for the actual blend
yeah,
because it costs me money. So, but I'll waive a consulting fee. I do the nurses all the time.
yeah. Oh, that's
They,
good.
they have as much anxiety as the patient does.
Well, exactly, and that what you were saying about being, you know, in a situation where it's emotional and you're around death a lot. It's when I go into the hospice at the moment, kind of thing, I get welled up with emotion. Of course, it's hard not to, but I think, my God, the poor nursing staff are here like all the time, and they
Yeah,
must.
well, they have to learn, and we usually take courses,
Mm,
and we all have to learn to separate. We can't get emotional over the ones, we can't attach ourselves to the ones that are dying, because otherwise we'd never be able to do this.
mm,
The I did it once, and it was the biggest mistake I ever did. It was one who reminded me of my father. He always joked, he was funny, he had the same color hair as my father, and I got very attached to him, and I was helping him.
mm,
When he died, it hit me.
mm,
And one of my colleagues came over to me and said, "You can't do this anymore. You cannot attach yourself, because you'll never make it in this field if you keep attaching. You could feel bad. I mean, we're human. You could feel bad when somebody dies. And I get emails all the time when one of my clients die. And I'll make something for them, and the following day they die, and I never get a chance to give them, what I made.
mhm,
The nursing, the hospice will still pay for it, but what we usually do is I mark it, and if I can use it on another patient, I will use it on someone else if
mhm,
that patient can handle the same oils or the same whatever I made. In a SAF, it's easy because it's not opened yet. So I just put it back either in my inventory, or I don't charge them, or if I already charged them because I had to physically make it, then I save it possibly for someone else.
mhm.
Sometimes I'll even give it to the nurse and say, "Here, can you handle these oils?" And I ask her, "Are you on any medication?" "No." "Here, take the bottle.
Okay.
Use it on yourself."
Oh, bless you. Robin, there's some fantastic stories that you just told us, and about how you work in the hospice. So I really thank you for sharing all your experiences, and how you work in a hospice situation. I think it's very honorable and lovely thing that doing that as well. So
Thank you.
thank you for sharing with everyone your beautiful story, and how you work in that situation. So I'm going to pop all your contact details, if you don't mind, just in the below. And if anyone else has any experiences as well as of working in hospice, please do pop them below, and Robin can share. You can have a chat about different experiences if,
Yeah.
if there's other therapists out there
You
that are.
can send me an email if you're interested in going into a hospice and you need some help. You can send me an email and I'll answer. And I
Yeah.
suggest take my course, which I will send you the link.
Yeah, please do, and I'll pop it in the below as well. So thanks again, Robin, for your time today.
Thank you for
And
having me.
no, it's great chatting with you, and I'm sure maybe we'll do it again next year. Again, it'd be great to catch up again. But we
Yeah,
speak before then anyway. So thanks
right.
everyone for joining today, and yeah, Robin, see you again soon.
Thank you.